Endometriosis is a chronic medical condition where tissue similar to the lining inside the uterus, known as the endometrium, starts to grow outside the uterus. These growths can occur on the ovaries, fallopian tubes, outer surface of the uterus, and other organs within the pelvis. Rarely, they can spread beyond the pelvic organs. To understand how endometriosis affects women, it's helpful to first explore how a healthy woman's body works throughout the menstrual cycle. The menstrual cycle is a monthly process that prepares a woman's body for pregnancy. It involves a complex interplay of hormones and has several key phases. The menstrual cycle begins with the follicular phase, days 1 to 13, which starts on the first day of menstruation and continues until ovulation. During this phase, the pituitary gland in the brain releases follicle-stimulating hormone, stimulating the ovaries to produce several follicles, each containing an egg. Typically, one follicle becomes dominant and matures, while the others regress. The maturing follicle produces estrogen, signaling the lining of the uterus, endometrium, to thicken in preparation for a potential pregnancy. Next is ovulation, day 14, where a surge in luteinizing hormone triggers the release of the mature egg from the ovary. The egg travels down the fallopian tube, where it may meet sperm and become fertilized. Following ovulation is the luteal phase, days 15 to 28. The empty follicle transforms into the corpus luteum, which produces progesterone. Progesterone further prepares the endometrium for a potential pregnancy by making it thicker and more receptive to a fertilized egg. If the egg is not fertilized, the corpus luteum breaks down, leading to a decrease in estrogen and progesterone levels. This drop in hormone levels causes the endometrium to shed, marking the beginning of the menstrual phase, days 1 to 5. During this phase, the uterus sheds its lining, which exits the body through the vagina as menstrual blood, starting the cycle anew. Now, when it comes to women with endometriosis, those misplaced tissues that grows on ovaries, fallopian tubes, and other pelvic organs respond to the same hormonal fluctuations as the uterine lining. They thicken, break down, and bleed just like the endometrium, but with a crucial difference: they have nowhere to go. This trapped blood and tissue irritate the surrounding areas, triggering inflammation and the hallmark symptom of endometriosis, which is chronic pain. The pain can be particularly severe during menstruation but might also occur during ovulation, bowel movements, urination, or sex. Furthermore, the inflammatory response can lead to scar tissue formation, adhesions, that can cause pelvic pain, restrict organ movement, and even contribute to infertility. Additionally, cysts, often called chocolate cysts, due to their content, can form on the ovaries, further increasing pain and potentially causing complications. Signs and symptoms. Symptoms of endometriosis can vary from woman to woman, and some may experience no symptoms at all. However, if you experience one or more of the following signs, it could mean you have endometriosis. 1. Very painful periods. Period pain is normal, but if you experience extremely painful periods, then chances are that you might have endometriosis. Usually accompanied with severe cramping and pelvic pain during your period. 2. Pain between periods. Pelvic pain can also occur outside your period, sometimes worsening during ovulation or bowel movements. 3. Heavy or irregular periods. You might have periods that last longer than usual or experience irregular bleeding patterns. 4. Infertility. Endometriosis can sometimes make it harder to get pregnant. Other symptoms. Pain during sex, fatigue, and digestive issues like bloating and diarrhea can also be associated with endometriosis. Important note: if you're experiencing any of these symptoms, it's important to see a doctor for diagnosis and treatment, as ignoring these symptoms can lead to complications down the line. Causes. The exact cause of endometriosis remains unknown, but there are several theories. 1. Retrograde menstruation. This theory suggests that during menstruation, some endometrial tissue travels backwards through the fallopian tubes and implants on other organs. 2. Embryonic cell implantation. Some believe that during embryonic development, cells that will become endometrial tissue implant outside the uterus. 3. Transformation of existing tissue. Another theory postulates that existing pelvic tissue might transform into endometriotic tissue. It's important to note that these are just theories, and more research is needed to pinpoint the exact cause. Diagnosis. There's no single test for endometriosis, but here are some ways it can be diagnosed. 1. Pelvic exam. A doctor may feel abnormalities like pelvic tenderness or endometrial implants during an exam. 2. Imaging tests. Laparoscopy, a minimally invasive surgery, is often used to confirm the presence of endometrial tissue outside the uterus. Ultrasound or MRI might also be used. 3. Biopsy. A tissue sample from the suspected implant might be taken during laparoscopy to confirm its endometrial tissue. Living with endometriosis. While there's no cure for endometriosis, there are effective ways to manage it and improve your quality of life. Here are some approaches. 1. Hormonal therapy. Birth control pills, progestin-only medications, or hormonal IUDs can help regulate your menstrual cycle and reduce endometrial growth outside the uterus. 2. Pain management. Over-the-counter pain relievers, prescription medications, and heat therapy can help manage pain associated with endometriosis. 3. Surgery. Laparoscopy is the most common surgical approach for endometriosis. It's a minimally invasive procedure where a thin tube with a camera, laparoscope, is inserted through a small incision in your abdomen. During laparoscopy, surgeons can 1. Visualize endometriosis. The camera allows surgeons to see the extent of endometrial implants, adhesions, and cysts. 2. Remove endometriosis. Using specialized tools inserted through additional small incisions, surgeons can remove or destroy visible endometrial implants with techniques like laser ablation or excision. 3. Adhesion removal or lysis. Laparoscopy can be used to break up and remove adhesions, which are bands of scar tissue that can cause pain and organ dysfunction. 4. Cyst drainage and excision. Ovarian endometriomas, chocolate cysts, can be drained, vaporized with lasers, or completely removed during laparoscopy. 5. Nerve ablation, presacral neurectomy. In some severe cases, laparoscopy may be used to target specific nerves involved in pain transmission, potentially reducing pelvic pain. In some situations, laparoscopy might not be suitable, and open surgery through a larger abdominal incision may be necessary. This is usually reserved for severe cases with extensive endometriosis or dense adhesions. Hysterectomy, the surgical removal of the uterus, and oophorectomy, the removal of the ovaries, are sometimes considered for women with severe endometriosis and debilitating pain that hasn't responded to other treatments. However, it's important to understand both the potential benefits and drawbacks of these procedures. Your doctor will walk you through before surgery commences. Thanks for watching. Please subscribe, share and like.